Good morning. I'm Dr. Dale Bratzler. I'm the Enterprise Chief Quality Officer here at OU Health and also the University Chief Code Officer. I'm going to go through a brief review of the data that we've seen this past week for the pandemic in Oklahoma, and then talk about a couple of studies that came out this week that I thought were interesting. So first thing today, we've gone over 250,000 confirmed cases in Oklahoma now, 251,000 confirmed cases in the state, more than 3,000 new cases that were reported today, and another 17 deaths that were reported today. For the week, 22,407 new cases confirmed in the state and 154 deaths in Oklahoma this week. So again, we continue to see lots of community spread of the virus, new cases, and of course, with people as many we have in the hospital, we're continuing to see deaths. 7-day rolling average today is at 3,200 new cases per day on average. So again, it just highlights that we have continued community spread of the virus. I've been particularly interested in what's happening in rural Oklahoma. Again, this week, Alfalfa County leads the pack in terms of the population incidence of COVID-19. And as of today, Alfalfa County is the #1 county in the nation for the population spread of COVID-19. Just to highlight, since the start of the pandemic, they've only had 816 cases, but they've had 243 cases in the past 1 week. So they are #1 in the nation with respect to population spread of COVID-19. A couple of points I want to make about testing. We know because of the snow and ice that some of the testing sites closed down. Last week I reported that there were 33,000 fewer tests done last week than the week before. And this week that trend seems to continue through yesterday. The state had reported 97,140 tests done this week in Oklahoma. Of those, 15.3% are positive. So we continue to see a very high rate of positivity, which means that we're continuing to see, again, community spread of the virus. In the hospital, the health department also changed their reporting, and I think it's everybody make sure that you're aware of that. The health department now is only reporting hospitalizations for confirmed cases of COVID-19. And there are 1,733 people in the hospital as of yesterday, with 460 of those patients in an intensive care unit bed. So 1,733 was actually the peak that we've seen in the state so far of confirmed COVID-19 cases in the hospital. Again, recognize that the reporting changed this past week, and persons under investigation are no longer included in the data that the health department reports. I wanted to highlight just a couple of studies that came out this past week that I thought were interesting. One was a Harris poll, more than 2,000 Americans, adults all 18 or older, that just looked at whether or not they were going to get a test done if they thought they might have COVID. And the sad thing was that 74% of the people who thought they might have COVID did not go get a test. And there were a variety of reasons. The most common one was that they had the misperception that they could put themselves at some risk of getting COVID if they went and got a test. But the other common reason was they did not want to be put into quarantine. Therefore, they avoided getting a test done. And that, from a public health perspective, is incredibly sad, because the only way to really slow the spread of this virus right now is to reduce the number of people that have active infection that are out in the community. They also noted that many of the patients that they surveyed were skipping medical treatment, and again, that highlights one of the concerns that we have in healthcare, that we will see many people who have delayed care and may have more complications or more severe disease in the future once healthcare gets back to its usual speed. The other study I just wanted to mention was really a news report from yesterday. Yesterday was a sad day in the United States. There were nearly 250,000 cases reported in the United States yesterday alone, the highest number ever. 113,000 people were admitted to the hospital yesterday in the United States, and there were 3,656 deaths in the United States just yesterday. That's more than 2 Americans every single minute of the day. So we're nowhere near out of this pandemic yet. There's still considerable spread. From the Johns Hopkins website this morning, we're at more than 17,243,000 cases in the United States, and more than 311,000 Americans have died of this disease. Finally, I've received a lot of questions this week, and I just want to highlight one point, that as vaccine is starting to roll out in Oklahoma, I think everybody needs to be aware that we're not going to see reductions in the number of cases. We're not going to see reductions in hospitalizations and ICU patients until we have enough vaccine and get it distributed enough to get it into the arms of the people who are at risk of the complications of this disease. The elderly, the sick, the frail, people who have underlying conditions that put them at risk for both hospitalization and death from COVID-19.
I don't want to put you on the spot with this because I haven't asked you this before, but those numbers for the United States are so terrifying. I just wondered, are there any places internationally or even a state, is there anywhere that's doing it right, that's really been doing a good job of bringing the numbers down?
Yeah, so the question is about, are there any states that are actually doing better at this point? And yes, there's considerable variation in the spread of the disease and the number of new cases by state. And there's even considerable variation of counties within Oklahoma with respect to spread of the virus. There are a few northeastern states that actually have really brought this virus under control and have much lower rates. As I think everybody is aware, the Midwest is where the pandemic has really spread to now, with really rapid growth of cases in states like North and South Dakota, Wisconsin, Kansas, Missouri, Oklahoma, the Midwestern states that have had very high rates of spread of the virus.
Okay, well, we're going to talk to Dr. Drevets for a few minutes. First, will you say your name and title for the camera?
Douglas Drevets, and I am the Chief of Infectious Diseases at OU Health and Regents Professor of Medicine at the OU College of Medicine.
Okay. So I had someone asking how do you think the vaccines are going? And I would like to expand on that and maybe talk about here at OU Health, who have we been vaccinating so far?
So our vaccination program really rolled out this week, and it is going well. We have an extremely organized process. Our folks in the pharmacy and IT have just done yeoman's work throughout last weekend, the weekend before, getting everything set up so we can have a fairly smooth process. What we've done is we are now vaccinating our frontline healthcare workers, and we've stratified our entire workforce according to their probability of occupational exposure to COVID. For example, we started out with individuals who worked daily and essentially all day in our COVID units or in the intensive care units or in the emergency departments. And this means everybody who works up there, so physicians, nurses, respiratory therapists, individuals in environmental services, dietitians, everybody who works up in there on a daily basis would have been in our first group, our so-called phase 1A. And then we stratified our entire workforce beyond that into 4 different phases, and we are slowly working through our phases as we have supply of vaccine. So it seems to be going well. It's an organized process. We have been able to get rid of some of the IT glitches at an early state, and we're looking forward to getting out as much vaccine as we can.
We've noticed a lot of these staff have just been really emotional about this is a big thing for them after what they've gone through since March and here at OU Health and the state. Can you maybe speak to that a little bit?
Well, it is an emotional thing, and nerves have been tight for months and probably for more than half a year. Our folks in the intensive care units in particular have been working hard, as have the individuals in the COVID units. And indeed, like everybody else, we've had employees who have become infected. Now, most of those are not workplace infections, but yet it does stress the workforce because then those employees are out of work for the period of time that they're contagious until they're cleared to come back to work. So by having the vaccine, that's the beginning of the end where you feel that you are at risk every time you walk into the hospital, in a sense.
This might be something that you both would want to address, but it's a good point to say that these people aren't being vaccinated necessarily to keep from spreading it, because we hope that they're doing the right things in the community because they know better, but it's to protect them so they can keep caring for these patients. And right now, that's just what we're looking at primarily, right?
Correct. So the numbers of vaccines that we're talking about here at OU Health that we've received so far, we are protecting our workforce so they can continue to care for patients. This is not a public health disease control type measure.
Yeah. So I think it's part of the reason I made the point I did about vaccines early. You know, healthcare workers have actually, you know, as Dr. Drevets mentioned, they've been under tremendous stress. I think one of the most emotional things that I saw was just thinking about all of the patients that they've cared for through the pandemic who have died of this disease, and just the first step in the process of getting the vaccine out that we can perhaps start to actually impact the way this disease is spreading in the community. Healthcare workers in general have done a pretty good job of staying safe. We don't see transmission much now in healthcare settings because healthcare workers know how to use personal protective equipment. We have good supplies of personal protective equipment. And as Dr. Drevets mentioned, most of the exposures that we see of our healthcare workers actually happen in events like household contacts or other things that happen outside of work. That said, they come to work every day in some of our COVID units where we have, you know, dozens of patients with COVID-19, many who require extensive respiratory treatment or mechanical ventilation. And so there's always concern for those healthcare workers about their risk of getting the disease, and it's a real relief for them to receive the vaccine.
Back to Dr. Drevets. Okay, a couple of general questions. How long does it take after vaccination to achieve immunity?
So full immunity does not start, full immunity is not achieved until about 1 to 2 weeks after receiving the second dose of the vaccine. So that's roughly a month, month and a half, depending upon which vaccine somebody receives. You do get partial immunity beginning at about 10 days after the first dose, but you really want to make sure that you continue to mask, continue to social distance, and go back and make sure that you do get the second dose of vaccine.
And for this Pfizer batch, it's 21 days, is that right?
That is correct. 21 days for the Pfizer, 28 days for the Moderna product.
Are we in, how close are we to seeing the Moderna?
So the FDA committee met yesterday, or the advisory committee to the FDA met yesterday. They voted unanimously to recommend that the Moderna product be approved for emergency use. The FDA is deliberating on that today, and we anticipate they will make a decision today if it's not already been made.
Is the vaccine safe for pregnant and breastfeeding women?
So the vaccine is considered safe for pregnant and breastfeeding women. The individuals who are pregnant, who are thinking about getting pregnant, might want to discuss this with their obstetrician or their other healthcare provider before receiving the vaccine. But pregnancy and breastfeeding are not a contraindication to receiving the vaccine. That said, pregnant women and those who are breastfeeding were not studied in either the Pfizer or the Moderna trials.
Okay. We have one reporter that's doing a story kind of on covering the viewpoints of people who are afraid to have the vaccine and basically debunking rumors. So you've talked about this a little bit over the last couple of weeks about some of the interesting rumors that we've heard, but this one, she's asking, she says, first of all, could you kind of explain exactly what's in the vaccine and how the idea of putting a tracking device or microchip in would be ludicrous?
So this is really, the mRNA vaccines are really wonderful in that they are a very stripped down type of a vaccine. There are really only two components: the messenger RNA, and this is the component that teaches your body what kind of a protein to make so that it can direct your immune response against that protein. The second thing that it contains is what's called a lipid nanoparticle. And this is a fat basically containing structure, and it encapsulates the mRNA inside of it. Think about a tennis ball with fat on the outside and mRNA on the inside, or perhaps an M&M, except it's soft on the inside and has mRNA on the soft on the outside and has mRNA on the inside. Also, that lipid nanoparticle, it also directs the vaccine to the proper cells, because the cells that can make the protein and then are going to help direct the immune response are able to eat these nanoparticles in a sense. And so there is no room for a tracking nanobot. There are no preservatives in it. There are no additional chemicals. It is a dead vaccine. You cannot get the infection from this vaccine. It is very clean, very stripped down.
I wonder if it's just the word nano that makes people think it's got to have some kind of opportunity to put something really sci-fi in there.
It is, and all nano means is very small. So it's 1,000th of a micro. So we think of micro being 1/1,000,000th of a meter, and nano is, 1,000th smaller than that.
Can you speak to any side effects, and if there's a possibility of severe side effects like stroke?
So there are always the possibility of severe side effects, although stroke is not one that's generally thought of. These vaccines do have some reactogenicity, meaning you do have injection site pain, and indeed, most people who received the vaccine in the clinical trials did report injection site pain. In addition, about half of individuals do feel something. They might feel fatigue, they might have muscle aches, they could have a headache. Probably less than 25% of individuals developed fever or chills from the vaccine. You also have to know that the second dose of the vaccine will more than likely induce more side effects than the first dose. Nevertheless, the vast majority of these side effects were graded as either mild or moderate. And at least in the Pfizer study, less than half of adults felt that they needed to take some kind of medicine for it.
Can you stress again that I think you said this before, that side effects actually means that your immune system is responding?
Many of the side effects, particularly the ones we call systemic side effects, say the muscle aches, the fever, are an indication that your body is responding and reacting to the product. And this is not necessarily a bad thing, it's just something that's going to happen.
Back to Dr. Bratzler, and I don't know if either of you can answer this one. It's just, she was asking how often are hospitals having to set up temporary areas to help COVID patients? We really haven't.
Yeah, so the question is how often are hospitals having to set up temporary areas to take care of COVID patients? So I think most people are aware that several of the hospitals around the state have set up tents, particularly around screening people outside of the emergency department and triaging them. But to the best of my knowledge, nobody has set up any hospital suites outside of the hospital itself. Now, at our medical center, and I suspect most in Oklahoma City, people are being held in the emergency department in rooms until beds are available in the inpatient setting or in the intensive care units, but we don't have any hospital beds or anything set up outside of the actual facility.
So we don't have a live stream scheduled for next week, so I just wondered if there's any last minute tips that you both might want to give to get through the holidays, or anything that you want to just wrap up with.
Well, so just I'll just say, so what about the holidays that are coming up? Because we had real concern about what would happen around Thanksgiving. Oklahoma seems to have done reasonably well, although we've seen some recent uptick in cases. But Christmas and New Year's are exactly the same with respect to people need to avoid, large crowds. They need to avoid large family gatherings. If they bring people into the home that don't typically live in the home, then we need them to think about wearing masks. It's going to be in the 50s on Christmas Day. Perhaps some activities can be taken outdoors. Protect yourselves. Try not to travel. This isn't the year to have the big family gathering. Hopefully, as we roll out vaccines this year, we can get to the point where perhaps next year we can have those old family gatherings that we used to love to have. It's just we're not there yet this year.
Wrap up with anything?
I think for now we have to continue to remember that we are not out of this, and indeed we are in the thick of it. There is a lot of virus out there, and indeed with less testing, that means there are many more people who have it than know that they have it. And so you just have to assume that in any group that you're in, there's a very good probability that somebody in that group has COVID. And you need to take care of yourself, and you need to take care of those people around you.
I just thought of one more thing, because I know that you're working on Christmas Day, and maybe just another just mention of, hospital workers, they don't have the same kind of holidays, and they don't have the same kind of weeks that we, the general public does. So next week on, Christmas Day, Christmas Eve, all those times, we still have a lot of people that are here caring for people. Emergencies happen on Christmas Day, but we're here, and so, maybe just a shout out to those people or something like that.
Yeah, I want to thank all of our employees and our staff, our faculty who are working through the holidays. It is tiring. We all do it. We have done it for many years. I remember back when I was a resident fellow, I worked 7 out of 8 straight Christmases. Fortunately, I don't have to work that many. Now it's only maybe 1 out of 2, and I am working this Christmas. So I look forward to seeing some of my friends and colleagues in the hospital. And for those of you who are off over the holidays, I wish you a wonderful time.